Hair loss is a common symptom of aging, but it could be something else. Hair loss, both baldness and significant thinning, can occur for a variety of reasons. Sometimes hair loss is a side effect of some health issues that should be addressed, and if the health problem is properly treated, the hair loss will reverse on its own. If you're experiencing hair loss or baldness, it's important to see a dermatologist to find out what's wrong and learn how to stop the loss or regrow. Before your appointment, watch this video on parshealthhtv to check out some of the most common causes of hair loss. Number 7. Hormonal imbalance. Excess androgens, or male hormones, and hormonal imbalances are the most common causes of hair loss, such as androgenetic alopecia, says Michelle Green, MD, a cosmetic dermatologist in New York City. Androgens have a significant role in female and male hair loss. In female pattern baldness, androgens cause hair follicles to weaken and also cause excessive shedding. Androgen sensitivity can increase during estrogen-related changes, such as birth control pills or menopause, explained Dr. Green. On the other hand, male pattern baldness is associated with an increase in an androgen called dihydrotestosterone, DHT. DHT not only binds to follicles and stops hair growth, but it can also shorten the overall lifespan of your hair, Dr. Green says. It is also called androgenetic alopecia. Researchers recognize many other medical conditions that can cause this kind of hair loss. These include high blood pressure, prostate cancer, heart disease, and polycystic ovary syndrome, PCOS. Number 6. Thyroid problems. Other types of hormone-related disorders can also cause hair loss. Some may be related to thyroid hormones. Hair loss can be caused by an underactive thyroid, a medical condition named hypothyroidism, or an overactive thyroid, hyperthyroidism, as each condition causes a hormonal imbalance. Autoimmune thyroid disorders, such as Hashimoto's thyroiditis and Graves' disease, can also cause hair loss, the Cleveland Clinic explains. Thyroid hormones help regulate almost every function in the body, including hair growth. The right treatment to control any of these thyroid conditions will control your hormones, stop hair loss and allow your hair to grow back. If you haven't subscribed yet, please subscribe to our channel and press the notification bell. Now, let's dive right into the number 5 on our list. Number 5. Certain medicines. According to the American Hair Loss Association, hair loss is a side effect of many medications created to treat common health problems. This is also named drug-induced hair loss. Blood thinners, oral contraceptives, depression medications, anti-inflammatory drugs, and beta and calcium channel blockers can cause hair loss or thinness. Too much vitamin A and retinoids can also cause hair loss. Some chemotherapy drugs utilized to treat cancer are known to destroy cancer cells, which can cause hair loss. Just as hair normally grows back after chemotherapy, it should grow back when you stop taking the medicine that causes hair loss. But don't stop taking your prescribed medication without talking to your doctor first. He or she may switch your drugs to a different medication to see if your hair loss improves. Number 4. Different types of alopecia, AA. Alopecia is the medical term used for hair loss, and alopecia areata is an autoimmune disorder in which the immune system attacks and destroys hair follicles, preventing new hair growth. Depending on the type of AA, hair may fall out only on the scalp or all over the body. According to the American Academy of Dermatology, this autoimmune disease can cause hair loss and partial or complete baldness and can be permanent or temporary and reversible. There are many reasons to get these types of diseases, including genetics. You should discuss possible treatments with your doctor. Number 3. Other autoimmune diseases. Alopecia areata is just one of the many autoimmune diseases that cause hair loss. According to studies, Hashimoto's thyroiditis and lupus are two kinds of other autoimmune diseases that can cause hair loss. This kind of hair loss may not always be reversible. Sometimes it can be permanent. But medication and hair restoration surgery can help compensate for any hair loss. If you have one of these autoimmune diseases, you are at risk of developing other diseases. That's why it's especially important that your doctor monitors you closely for new symptoms or other changes. Number 2. Physical trauma. When your body is subjected to severe physical stress, the natural cycle of hair growth and rest can be disrupted, causing damage, which often manifests as hair loss. Your hair can even appear on your stomach. Any shock to the system, such as a serious accident, surgery, burns, or serious condition, also shocks the hair follicles. According to Penn Medicine, this can cause up to 50 to 75% of hair to fall out, sometimes after just a few months. Also named telogen effluvium, this type of hair loss can disappear within 6 to 8 months. Infections and diseases can also cause hair loss. A high fever or severe infection can cause temporary hair loss. These physical injuries can include fungal infections of the skin, as well as bacterial infections such as syphilis, which can cause baldness or hair loss. Treating the underlying infection can restore hair growth and prevent further hair loss, so the first step is to seek medical attention for serious health problems. Number 1. Stress. Hair loss can be caused by significant stress, such as illness or surgery, which is physical and mental, says Green. Many people experience acute telogen effusion, when up to 70% of their hair follicles enter the telogen state, compared to about 10 to 20% of follicles that are normally in the telogen state. For example, with COVID-19, you may be surprised to learn that stress, not the disease itself, causes hair loss, according to the AAD. Hair loss is also a common side effect after a fever or during recovery from a general illness, the group notes. According to Penn Medicine, emotional trauma can cause acute telogen effects. When faced with a life-changing event such as a divorce or breakup, bankruptcy or other financial problems, loss of a home, or the death of a loved one, severe emotional stress can disrupt the normal hair growth cycle. Usually, this kind of hair loss is temporary, and once the stress is under control, the hair usually returns to its normal growth pattern. Hair loss usually occurs 3 to 6 months after a stressful event, says Green. To help support hair growth in this case, she recommends talking to a dermatologist about treatments that stimulate hair growth, such as minoxidil, Rogaine, or an office platelet-rich plasma, PRP. Please give us feedback in the comment section. Kindly like, comment, share, and subscribe for more quality videos. Thanks for tuning in. Wishing you a great day.